Well, this time of year, we're spending, of course, more time outdoors, soaking in the beautiful weather. But we need to remember it's also tick season.
And joining us with tips on how to protect ourselves is Dr. Peter Currie, Medical Director of Quality EPPA and the Urgency Room. Nice to have you here.
Good morning, sir.
Thank you very much.
Let's begin with, when is tick season?
Well, we're in tick season right now. It can start earlier in the spring, but the prime season is May, June, and July, when the ticks that we're particularly concerned about with Lyme disease are active at this time.
Of course, and you mentioned it right there, one of the main concerns we're worried about when it comes to ticks, of course, you get bit and it swells up and it's gross. You can deal with that, but of course it's the diseases that they carry, the Lyme disease being the number one. What types of tick spreads Lyme disease?
Well, locally there's just one type of tick, and it's the deer tick or black-legged tick. That's the specific tick that can transmit Lyme disease, and this is a small tick, typically described as the size of a head of a pin, as opposed to the larger ticks many people are familiar with, a wood tick.
Ooh, okay, that's good to know. So what are some of the signs that you have been infected and bitten, and is it just that, wasn't it just like a round circle or something?
Yeah, well, so you might become aware of a tick bite, but symptoms of Lyme disease, unfortunately some of them are really non-specific, like a flu-like syndrome or viral syndrome, headache and aches and perhaps a fever and some joint pain and stiffness. However, about 3/4 of people who get Lyme disease will have a very characteristic rash, and it looks like a bullseye. It's typically at the site where the tick has bitten you. And again, it's very specific. It's just one lesion, and it is diagnostic of Lyme disease.
Once it's determined that you have it, and sometimes that can be a mystery in and of itself, that can take a little bit of doing if you can't find the bite and that little rash is long. How is it treated?
Well, fortunately, the treatment is pretty straightforward. Antibiotics are effective. It's a bacterial illness, and antibiotics are effective in the treatment.
Okay, and what about, how can we prevent Lyme disease?
Well, mostly being smart about when you're outdoors, wearing protective clothing, simply long pants, long sleeves, and then an insect repellent that contains DEET is effective at repelling these particular type of ticks.
You know, it's not just humans that have this concern. Our pets also have a Lyme disease concern. We were talking during the break before you sat down. Is this, you were talking about a story with your own dog. Is this how you kind of got interested in Lyme disease and kind of pushed it this way? Tell us about what happened.
Well, several years ago I had a Labrador that came up lame, had stiffness, and then stopped eating. And when we took the dog to the veterinarian, the dog was diagnosed with Lyme disease. And it was some time ago, but it did make it apparent to me that it's much more common. And it's interesting locally here because it is very common here. There's certain hotbeds of the disease in the country, and we are in one of them.
We're like in a prime zone here.
Yep, in western Wisconsin and eastern Minnesota, but it has spread, formerly mostly in the St. Croix River Valley, but now much more widespread in Minnesota.
What do you do if you find a tick on your person, embedded in your skin? How do you remove it?
Well, we recommend you use a tweezers, grasp the tick as close to the skin as you can, and then pull upwards. And if you're successful in removing it, you can't see any, then cleanse the area. But this is something
alcohol or?
Yeah, soap and water would be fine, or some sort of a wound cleaner. Yeah, that would be fine. But this is something we see really commonly in the urgency room, is people who have difficulty removing ticks, or they're partially removed, or they're not sure how to do it. And so for the more complicated ones, that's something that we can definitely help with.
All right, Dr. Peter Currie, thank you so much for coming in today and talking about Lyme disease, and we're in the heart of tick season right now. So think about things to think about.
Thank you, Dr. Currie.
Thank you for having me.
For more information, you can go to urgencyroom.com. The Urgency Room is also on Facebook and Twitter, discussing all things related to health.